A 17-year-old has died in Winnipeg from complications from influenza, and that is the second young person to die this year in the province. A young woman in her 20s also died. Our Karen Paul's now with the multiple strains that are surging at the same time.
She loved to laugh.
Dustin and Joanne Entz were married just 8 months ago. On Sunday, family and friends gathered in church again, but this time to bury her. Her husband is clinging to his faith to help him carry on.
It is confusing, but there is moments of grace.
Joanne had asthma, but Dustin says she was healthy when she caught the flu on New Year's Eve.
She was very weak and very crackly breathing.
They went to the nearest emergency department near Morden, Manitoba. Doctors there had her airlifted to Winnipeg, about 125 kilometers away.
But she was in septic shock and they were unable to do anything.
Dustin says doctors have confirmed his wife died of complications stemming from influenza B.
Flu season seems to be hitting young people particularly hard. In this town alone, up to 25% of the students were home sick before Christmas. Now in Winnipeg, a grade 12 student has died of complications of the flu.
Blaine Rupental's family says his heart stopped. They don't know why, but doctors told them it's connected to influenza complications. Students at his high school say he'll be missed. Public health officials are scrambling to deal with a surge of flu patients. Just last week, they activated an emergency flu response plan.
Very unusual year this year, where influenza A, influenza B, and respiratory illnesses have all come at the same time.
And I would frequently tell her that I loved her to the moon and back, and she would respond with, "I am her sun, moon, and stars."
Dustin Entz and his wife had planned to get their flu shot after New Year's. He hopes their story encourages others to get the vaccination. Karen Paul's, CBC News, Morden, Manitoba.
Well, for more on the illness behind these cases, I did speak to Dr. Samir Gupta. He, a respirologist, also an associate professor in the Department of Medicine at the University of Toronto. And he says these recent deaths highlight the dangers of the flu.
This happens every year in the news cycle because it's always shocking, and when somebody young who's otherwise healthy or relatively healthy succumbs to the flu. But the reality is that, in fact, this happens every year. Unfortunately, healthy people do succumb to the flu, and it doesn't happen often, but it happens every year. We know that there were 17 deaths from the flu in Manitoba last year. So what we're seeing now is probably the beginning of a trend that's quite similar. What's a little bit different, I will say, at least in the Toronto area, we're hearing from the Public Health Lab that we're seeing more cases of flu. So, by the end of the first week of January, there were 482 cases in the GTA that week. And cumulatively, we'd had about 1,000 cases. And that means lab-confirmed cases. So it's tip of the iceberg. Most people will not have a lab test for their flu. But if you look at the last 5 years, the average cumulative would have been about 630 by that point. So we're definitely seeing more cases.
What about the flu shot, though? Because, of course, back in the fall, late September, early October, the signs started going up about getting your flu vaccine. Is it too late if you haven't done that?
So we talked about it in November, and we said, this is a good time to think about it, go out there and get your flu shot. But the reality is that the flu season will last until March, and we even see cases into May. So, if you get your shot today, it takes about 2 weeks to get the full benefit, the full immunity from the shot, but there's still a lot of time left. So there's certainly still a benefit of getting the shot today. And I'll also say that, healthcare practitioners are the first to recognize that it's not 100% effective as a vaccine. Typically, it's about 50% effective. But don't forget that if you've had the shot and you happen to catch the flu, usually you'll have a less severe type of flu. So still lots of good reasons for people to go out and get the flu shot now.